I hate to report that there are some new areas added. Information technology acquisition, that's really not much of a surprise, but it's very disappointing to hear that VA Veterans Affairs Healthcare has been added to this, and this hits pretty close to home with both Senator Baldwin and myself. We have a facility in Tomah. Over the last couple of years, we've lost 3 veterans to the system. 2 died with deaths related to potential opiate drug over prescription, and not even a month ago, a 74-year-old veteran with, I'm not a doctor, but pretty obvious stroke symptoms, sat and waited in a waiting room for 3 hours to be treated, probably had a stroke, was wheeled into an examination room, waited another 45 minutes, had a massive stroke, was finally ambulanced to a different hospital. The CT scanner was apparently not operational, so they couldn't administer anticoagulant drugs, and this gentleman died 2 days later. So it is noteworthy to understand that GAO has been making recommendations to the veterans' healthcare system for a number of years. There are more than 100 recommendations that have not been implemented, about 80% of the recommendations. So certainly what I'd like to get out of this committee, out of this hearing, and hopefully out of committee action, is coming up with some kind of method, some kind of control to make sure that these good recommendations that save the taxpayer so many dollars that could potentially save lives are actually implemented. I think that has to be a top priority of this committee. Let's utilize the guidepost of the GAO high risk list and the other good work they do, and let's make sure these recommendations are finally implemented at the agency level. It will save money, it will save lives.